Hey guys, today we're going to talk a little bit about PEEP, what it is, what it does, how it works, and how can we use it in the field to help better treat our patients. All right, so what is PEEP? PEEP stands for Positive End-Expiratory Pressure. Basically, it's a technique used to keep the alveoli open during the exhalation phase. This is especially important in patients with pre-existing respiratory conditions such as acute respiratory distress syndrome, pneumonia, COPD, and many others. All right, so before we get too far into talking about PEEP, let's make this make a little more sense for everybody. The average healthy adult has about 3 to 5 centimeters of water, which is how we measure it, of PEEP that remains in their lungs following the exhalation phase. Cool. So what does that mean to us? Well, let's break it down a little further so it makes just a little bit more sense. This means that there is more pressure above the normal atmospheric pressure that remains in the lungs to keep those alveoli open for better oxygen exchange. So why does PEEP matter to us as paramedics?
Whoop, whoop. Here I come. Oh, here I come. Oh.
Well, it improves that oxygenation by increasing the surface area for gas exchange by keeping those alveoli open in those patients. By preventing the alveolar collapse, using PEEP decreases the effort required for breathing, especially in those patients with lung diseases or other conditions that you will encounter in the field. Lastly, it can improve patient outcomes of those that require high FiO2 or those that require mechanical ventilation. There's a couple different options that we have for applying PEEP in the field. One of the options that we have is using it with a BVM. Ambu usually has a PEEP valve that comes with it, but you'll have to double check and see if your local hospital has those. They either come in the bag or they'll come separately. But what you can do is you take the PEEP valve, and these are adjustable from 0 to 20 centimeters of water. 0 is going to be your regular atmospheric pressure, and 20 is going to be a lot. We are going to titrate to effect to help improve the oxygenation in the patient. What we're going to do is we'll take the top off if there is a bypass valve on the top, remove that, and we'll take our PEEP valve and place it directly inside. From there, we will adjust it to help improve that patient's oxygenation and titrate to the best effect. Another way that we can apply PEEP in the field is by utilizing a CPAP mask. The mask that we're going to go over is a Mercury Medical FlowSafe 2 with an Easy Neb. We're going to break this down a little bit more and talk about how our oxygen flow affects our PEEP and how using a neb both on and off affects our PEEP as well. So let's talk about this setup a little bit. The FlowSafe 2 Easy combines a CPAP as well as an integrated nebulizer device. And the benefit of this is that when we have these two working together, we can power both of these devices off of one single oxygen source. This unit can be utilized both with and without the nebulizer device via a switch located on the front of the unit that can redirect the flow of the provided oxygen source to the nebulizer's medication chamber. However, it is extremely important to remember that the pressure is reduced when the neb is activated due to the redirecting of the incoming oxygen into the nebulizer device. To compensate for this, the provider will need to increase the pressure to maintain the required amount of PEEP being applied to the patient. So as we all know, monitoring end-tidal capnography in these patients is extremely vital. We want to make sure that we are treating this patient to the best of our abilities and that our treatment is creating effective results. Although the standard endotracheal tube end-tidal capnography sensor will fit between the mask and the nebulizer's connection ends, this point of monitoring is proven to be ineffective. The preferred method for monitoring end-tidal capnography on a patient receiving CPAP is to apply a nasal cannula with the integrated waveform capnography monitoring capabilities that is to be applied to the patient prior to the CPAP mask application. So now we're going to focus on applying PEEP at different pressures with our CPAP. And what we're going to do is we're going to use this yellow tag. A lot of medics have looked at this yellow tag and immediately got confused. Once you read it, once you learn about it, you'll understand what it means and how we can adjust our flow rates of our oxygen to increase PEEP, decrease PEEP, and how using the neb both on and off is going to affect those pressures. So taking a look at our flow chart, this side is going to show how our flow rate is going to affect our CPAP pressure or PEEP pressure based on when the nebulizer is off and when it is on. If I have my flow rate set at 6 liters per minute, my PEEP pressure with the nebulizer off will be 2 to 3 centimeters of water of PEEP. If the nebulizer is on and active, the CPAP pressure is going to be 1 to 2 centimeters of water of PEEP. On the same note, if I increase to 10 liters with the nebulizer off, my CPAP pressure is going to be 6 to 7. With the nebulizer on, it's going to be 2 to 3. And as we go down and increase our flow pressure of oxygen, our PEEP is going to increase. But again, we got to keep in mind that when our nebulizer is on and active, our flow is going to decrease. So we may have to increase our flow of oxygen to provide more PEEP to make up for the amount lost that's redirected into the nebulizer. So let's take a look at the other side now. On this side, it's going to show my CPAP pressure, the flow required with the oxygen source in liters per minute with the nebulizer off, and the flow required with the oxygen source with the nebulizer on. If I want 5 centimeters of water of PEEP, my nebulizer is off, I will need 8 to 9 liters of oxygen. If my nebulizer is on, I will need 15 to 16 liters of oxygen. And it keeps increasing. As we go to 7.5 of PEEP needed, my neb is off, I'm going to need 10 to 12 liters of oxygen. If my nebulizer is on, I'm going to need 19 to 20 liters of oxygen. All right, so if you're still watching this and you're like, what? That's fine, I got you. I'm a visual learner. I need to see things. I need to see how things operate, come together, and how they produce an outcome or produce a change. So what we're gonna do is we're gonna get a mannequin, we're gonna intubate it, and we're gonna do some live feedback and show on a waveform how increasing PEEP, decreasing PEEP, increasing pressures, utilizing the nebulizer, how that changes our PEEP pressures, and how that's gonna affect our outcomes. Go in the hole. Yes. Yes. Oh, what the f? Oh, yeah, that's in the stomach. Should have been a cop. First try. So we got our mannequin intubated. We have him on a ventilator. We're going to be delivering a rate of 10 breaths per minute, starting out at 0 PEEP with 600 cc's of tidal volume. As we go along, we're going to increase from 0 to 5 a PEEP to 10 a PEEP and back down. In that graph, you're going to watch that line go up and go back down, starting with 0 PEEP. As we increase our PEEP, you'll see it go up and slowly start to kind of ramp back down and kind of drag out a little bit longer. And as we increase some more and more PEEP, you'll see that downstroke kind of start to drag out longer and longer and longer. So we're keeping that air in the lungs stented open. Towards the end, once we release the pressure and start to back it down, you'll see it return back to normal, going right up and then right back down. So we have the mannequin on the ventilator. We're delivering 0 PEEP, and you'll notice that sharp uprise and straight back down. So as we start increasing our PEEP to 5, you'll watch that graph rise up a little bit slower and come back down a little bit slower as well. As we keep going, we're going to watch that graph keep rising and rising and rising with the increase of PEEP. As we increase our PEEP to 10, You'll notice a change in the rise and the fall. It's greater than it was before, and it's starting to become a little bit slower as well. Now we're going to decrease our PEEP to 5, and we're going to watch as the bar starts to trend downwards with our decrease in PEEP. Now we're going to decrease our PEEP all the way back down to 0, or atmospheric pressure, and you'll see that bar graph go back to baseline at where we had it initially starting at. Watching this is showing us how PEEP is affecting our lungs or the patient's lungs, and how it's keeping it stented open and more pressure inside of there. So just a quick recap, we talked about applying PEEP with a PEEP valve and a BVM, as well as utilizing PEEP with a CPAP mask. Applying PEEP to these patients is crucial, and it's going to affect the overall performance of our interventions and how that patient is going to respond to them. I hope you guys enjoyed the video. I hope things made a little bit more sense to you if they didn't before, or at least it was a good refresher for you. So thank you.